Now, it's estimated that 2 million people will be diagnosed with cancer in the U.S. this year. Hundreds of thousands will die. But what if we could get a diagnosis sooner? Well, with the help of technology, some companies are claiming to do just that with a full body MRI, but it's not covered by insurance. So the question is it worth it? KCAL News reporter Joy Benedict takes a look.
Look around any crowd and it's easy to see the happy and sad, the seasoned and the future. But what lies beneath the surface of our skin has always been somewhat of a mystery.
Here is a sagittal view of the brain.
But the newest trend in healthcare is offering a peek at what most have never seen before, a hidden view inside the window of our own bodies and our health.
I feel fine, so I just want to make sure that everything I feel is accurate.
Brett Matthew is a seemingly healthy 32-year-old. We found him waiting in the lobby of Prenuvo. At first glance, it looks like a spa, but this company is one of several offering full-body MRI scans as an elective, promising proactive screening for hundreds of potential health issues, including cancer.
Just some general checkup, basically, for see how my body's doing. I had a skin cancer issue in the past, so I just want to make sure that the rest of my body is all good to go.
This procedure isn't covered by health insurance or even referred by your doctor. It's something celebrities are touting on social media, and patients are choosing to pay thousands of dollars for just in case.
I entered my 40s, I had a bit of a midlife crisis, and I wanted to really answer this question, am I healthy?
Andrew Lacey is Prenuvo's CEO.
We started this company because we felt like the existing health system really wasn't doing a great job looking after our health. It's very reactive, and in that reactive system, a lot of horrible diseases like cancer are typically caught really late. So we wanted to imagine a different way of doing healthcare. It's not incrementally different, it's transformative.
In the last 4 years, Lacey has taken the idea and technology started by a radiologist in Vancouver and opened Prenuvo clinics in 7 cities, with 8 more clinics scheduled to open in the next year.
We have now diagnosed something like 250,000 medical conditions, most of which people didn't know about before they had the scan.
But these types of scans have plenty of critics.
There's no evidence it's going to help them, and it has potential harms.
Dr. Joanne Elmore is a physician and educator at the School of Medicine at UCLA. She joins the American College of Preventive Medicine and the American College of Radiology, who also think these types of scans are unnecessary.
If you're getting this exam for reassurance and to calm your anxiety about potentially having diseases, being told you have lots of potential abnormalities inside your body that then are going to lead you to have multiple tests is problematic.
She says we all have abnormalities in our bodies, and although MRIs themselves have little known side effects, she says the rabbit hole of possible issues can drain your mental health and your budget.
It can put you on a perilous cascade. There's no scientific evidence that detecting these lesions earlier is going to save lives. If there was, I would recommend it.
But the counter is, why not?
Why not do what mammogram did for women and breast cancer and do that for the whole body?
So we decided to pay for Prenuvo's full body scan, totaling $2,499. After filling out a detailed medical questionnaire to make sure the scan was safe for me, I headed into the clinic and laid down on the advanced MRI machine for about 50 minutes. It took 2,000 images in 26 different areas. 10 days later, I got a very detailed report and a call from a nurse practitioner. In every section, any findings were labeled as informational, minor, or moderate, and they included a description and photos. The issues recommended for me to follow up on were things I already knew about: asymmetric tissue in my breast, a cyst near my ovaries, and consequences of a thyroid disorder. And then there were minor things I didn't know about, with recommendations like work on my posture. But with 2 grandmothers who died of breast cancer and a father who recently passed, also from cancer, I found the images informative and fascinating.
But just knowing that this is happening early means that you can make lifestyle adjustments and hopefully never end up having to get medically treated for that condition.
As for Matthew, he decided not to share his results, just saying they were not what he was looking for. A private battle for health we all face, and a fight for knowledge that companies like Prenuvo hope we will all pay to see. Joy Benedict, KCAL News.
We want to thank our Joy for that report.